demonstrating PRP injections. What PRP is when we take platelets that have been spun down. So she had her blood drawn earlier, and then we go ahead and spin the blood down in her centrifuge. And then after it's separated, we draw it up in a syringe, and then this is what we'll be doing, is injecting into the skin. And so what the plasma will do for lips is it helps with fine lines, helps to stimulate collagen production. And we've also noticed that it helps to increase the pigment or the color of the lip. So as we age, the color of our lips starts to fade. So this helps to stimulate the color to make them pinker. So I'll begin by injecting some of the plasma into her lower lip. So 1, 2, 3, you're gonna have a little poke, big deep breath, okay, good. And we put a little bit of lidocaine into the plasma, so it will sting her a little bit and then she'll numb. 1, 2, 3, big deep breath, okay, good, breathe. Now we'll do this side, so once again, 1, 2, 3, a little poke, big deep breath. So 1, 2, 3, big deep breath. And here comes a sting, and she's feeling a sting, and her lips are done. All right, so next we're going to do under the eyes, or it is also called tear troughs, and I'm just going to wipe away some numbing cream that we put underneath here. And the benefits of doing the tear trough area: it helps to thicken the skin, it helps with the fine lines, the texture of the under eye area. And then we'll do one more right underneath her eye. So 1, 2, 3, a little poke. And then I'll come back after I inject the other side, and I'll spread the plasma throughout the tear trough area. So next I'm going to inject into her nasolabial fold. So a little poke.
What will this do? Will it help with the
texture and the fine lines of her skin here? Right, so next I'm going to inject down in her marionette area. And it will help with the fine lines down here. And the plasma is a growth factor. 1, 2, 3, a little poke. So it's the growth factor that stimulates the collagen. We allow an hour for PRP injection treatment. We recommend you have a series of 3 every 4 to 6 weeks. And it's not uncommon to have a little pinpoint bleeding from an injection site. This is a PRP injection treatment that I've just finished. So PRP does not take the place of filler or Botox. PRP is a collagen stimulator. Botox works on the muscle, it's a neuromodulator, and fillers help to enhance an area. So this is just an additional treatment that we do here at Maffi Clinics. And I like to take the HA intensifier, and I like to spread out the plasma. So I just put a couple drops.
And what is this for?
It helps to spread the plasma that I just injected. So on her lips, now go ahead and rub your lips together. Good. And the aftercare after having a PRP injection, you can go out, you can put makeup on. They're going to be a little bit numb in the area for maybe a half hour, 45 minutes, but there's no downtime with this. Always a possible chance of bruising, but nothing that you can't cover up with a little bit of makeup. And then we'll see her back in 4 to 6 weeks, and we'll do her second treatment. In addition, so I just demonstrated a PRP injection. This treatment can be piggybacked onto a microneedling, where the esthetician will do a microneedling, put plasma on the skin, and then the patient comes over to me, and then I inject plasma into the areas that you've just seen.